Hey, Dr. Schnitt here from Inspired Cosmetic Surgery. I'm going to talk today about tummy tucks and how to do a tummy tuck and what a tummy tuck is all about. The technical name for this is called abdominoplasty. And the way that's done, especially if somebody's already had a C-section, we try to include or eliminate the C-section scar, but otherwise the scar is placed at about the same level. We try to keep the scar very low. So an incision in a mini tummy tuck, which is only good for certain people, and I'll do another video explaining the difference between a mini and a regular tummy tuck, but we take this incision and that goes typically in a full tummy tuck hip to hip. In a mini tummy tuck, it stops about here. So hip to hip for a full tummy tuck, we try to keep this incision low so it hides in new style bathing suits and lingerie. So that incision goes straight across. We then elevate this tissue. So the whole front abdominal wall is elevated, and we do make an incision around the belly button. Now, some of us had certain techniques on what the shape of that incision is to get a nicer belly button, but we elevate all of this tissue. The belly button stays where it is, and all this tissue gets elevated right up until an area called the xiphoid process, which is a little bone from the rib cage that sticks down here, really off of the bottom of the sternum. So we lift all of this up, and once this tissue is elevated, we retract it up, and we actually remove the tissue from here to here. So all of this tissue gets taken out. So that allows a lot of excess skin and draping skin to be removed. Remember, the belly button stays behind, and everything else comes out. That tissue gets removed. Then we get exposure to the entire anterior abdominal wall here. And this is the linea alba, or the line that kind of divides the rectus abdominis muscles, or the abs, and that goes straight down the midline like this. This is generally stretched out or has laxity, and we do something called abdominal wall plication. The laxity, the technical term is called Diastasis Recti, and we take sutures and we tighten all of this tissue straight down the abdominal wall, all the way to the level of the umbilicus. We tie that and flatten and tighten the whole abdominal wall. We do the same thing below the umbilicus with another suture line and tighten that entire line there. So that gets all tightened down. When this is completed, we generally sit the patient up to get the maximum stretch on this tissue. And this tissue, where we excised up here, gets stretched down to the incision here and closed. So all of this gets tightened down, so now you have a flat, tight abdominal wall. Before we close, we leave drains up inside, so those are like a clear rubber silicone tube that stays inside and actually comes out somewhere along the abdominal wound into a tube out here, and then to a rubber bulb, or a silicone rubber bulb. We squeeze this bulb, and by its natural ability to expand, it actually provides suction and takes out excess fluid as the patient is healing. The stitches that we use to close this abdominal incision all dissolve. Sometimes we trim little stitches here and there, but the stitches go away on their own, and then we allow the patient to heal.